disadvantage. Advantage is that exactly you are doing 10 o'clock. AC is continuously maintained. Person is in mask and every day is changing the mask, and temperatures are constantly maintained. Humidity is constantly maintained. But what will happen? A normal level laboratory or a small scale pharmaceutical industry cannot afford for any research or cannot set up its research unit itself, because the experiments become so much costly. Probably R.Y. Patil sir is there on this one. When we were in pharmacology, we used to get dogs at 6 to 10 rupees from corporation. We used to dissect the dogs and find out effect of drugs, etc. After PETA came and so many animal pet organizations, today no dog experiments. Nobody. We are not permitted for doing dog experiments because dogs are not inbred. Dogs are street dogs. Corporation wanted to catch them because of dog menace. Instead of cremating them, they used to sell to a college, and 10 rupees. They used to be very happy that they have got 10 rupees in the year 1985-87, and they used to walk away. And we used to dissect the dog and this one. But problem comes: what type of food the dog has eaten on the streets? What is its body weight? What type of food it was feeding? Maybe suppose if a dog is near a meat shop, it is eating everyday meat. Maybe dog is running in some vegetarian people's colony. It is eating only roti and chapatis and rice. So its biological standards keep on altering, physiological parameters keep on altering that affect the drug activity. So this was the reason how Maneka Gandhi defended that you should not do any experiments on the dogs because parameters are not standard. So now what is the question? Now I want to do inbred rats. I will do inbreeding. So within 21 days I get colony of dogs, colony of rats. How do I breed a dog to get immediately for studies? So many dogs. Rats give so many 10 to 12 puppies. But what about litters in rats? Rat puppies are called as litters. For a dog, we call it as puppies. Everything, every animal has its own particular name. For lion, we call it as a cub, and for this one, cows, we call it as a calf. So every offspring has its own particular specific name. So here, rat is litters. Rat gives litters. And in case of this one dogs, dog we call it as puppies. So these dog puppies, how many puppies a dog can give? It will be maybe 3 or 4, out of which 1 or 2 it will eat on itself, because if it is hungry, mother dog is hungry, it is called cannibalism. Cannibalism in the sense the mother's eating its own offsprings when it is in starving condition. This is seen in this one. Cats, we can find this activity. In dogs, we find this activity, and we find this activity in snakes also. Snakes, after giving birth to so many snakes, mother snake eats away 2 or 3 snakes itself, so as to fill its stomach because it has become so much weak. So that is how this that's cannibalism, including rats. If you don't give food to rats, rat will eat its own offsprings. That is cannibalism. So now our crux of discussion in good laboratory practice is that whether temperature is maintained, light conditions are maintained, isolation is maintained, person has been calibrated, instruments have been calibrated. This is what is GLP. So whatever we do, it has to be documented when it was cleaned, when it was fed, when it was given a particular water you are giving. Yes, I was quoting the example of dogs when we were students. We used to do so many experiments on this one. Today also, to grow a dog, it requires 1 to 2 years of time, so that it becomes fit for an adult dog and experimentation. That means you have to wait for 1 year to have a dog. This is the difficulty. So for 1 year, no experiment. You have to sit idle, or else you have to depend on a laboratory which supplies these raw dogs as and when you want. In India, we don't have this one. In America, European countries, we have this supply of dogs. Do you know the cost of this dog? It will cost at least 1 to 1.5 lakhs per dog. As I told you, corporation people used to give one dog for 6 to 10 rupees. Now each dog experiment will cost 1 lakh rupees. Suppose if you want to maintain n is equal to 3 lakh rupees. for one experiment, result of which we do not know. So that means they become exorbitantly costly experiments. A common laboratory, common college cannot afford it. Colleges, of course, they cannot afford it. I was inquiring about Langendorf apparatus with one of the companies. He first refused me to give. He asked me from where you are speaking. I said, I'm principal of a college. Then he said, sir, it is not for you, Langendorf apparatus. I said, why it is not for us? I am also a pharmacologist. And sir, the cost of Langendorf apparatus is 52 lakhs, sir, which a college in India cannot afford. That is why we are not giving any quotation. The Langendorf, which used to cost early 3,000 rupees for isolated rat heart, etc., rabbit heart, guinea pig heart, it costs 52 lakh rupees. So, how many colleges can afford to give a Langendorf apparatus of 52 lakh rupees? So, this is where we start facing difficulties, financial difficulties. India being one of the not rich country, you can imagine the difficulties uh, that we keep on facing. So this is how the experiments become very costly. There will be monopoly. So some of the countries, rich countries, will start exploiting, and they may say that this rat will cost so and so amount. This much sample will cost so and so amount, which becomes very difficult. So what will happen ultimately? We surrender to them, and we take the drugs whatever they are selling at whatever cost. We depend for everything from them only. That means our exchequer is going to them. Their exchequer is not coming to us. We are unable to export because we are unable to do any research. But they have a lot of money. They are doing research, so they put medicine at any rate, and then they say, you know the cost of remdesivir, the story of remdesivir. So this is what will happen. So every aspect of the study has an advantage, has a disadvantage. Similarly, in good laboratory practices also, it is very good that we get very good quality drug and assured drug. Earlier, it used to be quality control department. Now, today it is quality assurance department, QA. That means you have to assure, yes, my drug is of this quality. My drug is 100% pure. This is quality assurance. Quality control means simply I am controlling the parameters. I am cleaning the laboratory. I am doing cleaning of the machine, tablet machine. This is control. Quality assurance means, yes, from my firm, this is the drug quality of the drug. This is quality assurance or QA. From QC, we are in QA. So that is how these good laboratory practices make one of the important aspects of the study. Basically, it's meant for exporting of the drugs to various countries, and to rely that to claim that our drug is of so and so quality wherever it is taken. It may be European country, it may be Arab country, it may be an African country, wherever it is taken. Yes, my drug is of so and so quality. So that is what is good laboratory practice. So I almost made it as a summary and I gave, but if you want point wise also, I can read. There is no problem. So that is what is the intention is to promote international cooperation and harmonization. It gives a guidelines developed by Organization for Economic Cooperation and Development (OECD) for member countries, and it will help in the risk and the safety assessment. And the components include various machineries, and it includes test articles. Test articles means food additives, colors, drugs. So many tablets that come in so many colors, isn't it? Colors, I will tell you again. Interest colors. Something mind keeps on going here and there. Ice creams we keep on eating, ice fruits, etc. In childhood, we all have eaten that one. So they put color, red color, orange color, yellow color. It will look so very attractive, and we keep on eating. But our intention is to eat ice cream. But color is coming as an attraction. It has no quality of food. But have we ever tested that the color that was added is safe to the human beings or consumption? So that is, we have to validate this one. That means you have to take only the color. Suppose if a tablet is orange color, you have to take that orange color, give to the animals, rats, study for acute toxicity, subacute toxicity, chronic toxicity that we have discussed yesterday for 2 years. Then sacrifice the animal, observe all other things, and after killing, sacrificing the animal, take a cross section of kidney, liver, heart, brain, intestine, and then check whether there is any change due to that coloring agent. Similarly, we had so many food additives, starches we had, tragacanth we had, and so many things, additives, lubricants we had, in manufacturing medicines, colorants we had, so many cup syrups or other syrups, suspensions, come in attractive colors, sunset yellow color, amber color, something like that. So many colors keep on coming. But have we ever tested these substances, whether they are safe or not? If you are not tested, you cannot export. If you are tested, you can export. If you are not tested, you cannot export. You are not part of GLP. So you have to manufacture your drugs in your own country and sell it in your own country only. You cannot sell outside. So this is what is GLP. That is test articles and the colors and the instruments that we are operating, and SOPs. SOPs stand for standard operating procedures. That is, you have to display that I have. Now let us say, again, day-to-day example only. You have some sample, you want to do analysis because you have 10 samples in your hand. You come and switch on your GC or IR, keep the sample, take the reading, and then switch off and go off. 10 sample, 1, 2, 3, 4, 5, something like that. Now, company says that you have to switch on the instrument, wait for 15 minutes, and then you keep your sample. Have you waited for 15 minutes? If you have waited for 15 minutes for stabilization, have you recorded this one? Where it is recorded, whether any camera is there, that at 10 o'clock I have switched on the instrument, 10:15 I have put my first sample. Is this recorded? If you are recorded, you export it. If it's not recorded, you are not maintained GLPs. So this is what is GLP. That is every step that we are doing, whether it is a checking of solvent, whether it is additive, whether it is a colorant, whether it is a sweetener, whatever we do, it has to be quality certified, then only it is permitted. So that is what is part of GLP. Then personal, I have already told what are the personal, whether a qualified person. Again, I will come to a interesting day-to-day example. Nursing homes, you have seen. In nursing homes, actually they are supposed to appoint one qualified BSc nursing or whatever the qualified nurses during the helping of the delivery. How many of the nursing homes in your place or wherever you go have qualified nurses for a delivery? Most of the times they are illiterate IMAs or DIAs. Some might have studied, gone to school, some maybe of 8th standard, some maybe 10th standard. They do not know anything about scientific infections or anything, but still they are IMAs and DIMAs, because you can hire them at cheaper rates. Qualified nurse will ask for a standard salary. In that one salary, you can hire 5 IMAs and IMAs. So this is where it makes a difference. That is, suppose if you want a particular personnel, if somebody is at a cheaper, working for a cheaper salary, is he qualified rightly? Whether his qualification is up to the mark, or is permitted to test those instruments, or simply you have trained him 1 week and ask him, "Oh, go and do." Like medical, one more example, medical representative. Earlier, medical representative means at least a BSc, D Pharma, something, so that he can speak what is a particular drug, antihistaminic or analgesic, something like that. Today, companies advertise MR posts available or interviews. Whoever can speak good in English, it may be arts graduate. Intention is to only market there, not to convey what are the positive aspects of a drug, what are the risk factors of a drug, because he has never studied about that one. But he is available at cheaper rate, but can speak a very beautiful English in a beautiful accent. So this is where it is making difference. If a qualified person is there, it is part of GLP. Non-qualified, non-GLP. Nursing home, you want GLP. If a qualified nurse is appointed, GLP. Non-qualified nurse, no GLP. So this is where the definition starts, and this is where we lead. And then we should have master schedules. As I said, master schedule in the sense, 8 o'clock I clean the laboratory, 9 o'clock I feed with food, 10 o'clock I do this one, evening 4 o'clock I clean the bedding of the cage, provide fed fresh bedding, I provide fresh water. Water again, from where you are getting this water? Now we have seen in Rajasthan, etc., people get down deep the well, 100 feet well, to fetch one pot of drinking water. This is for human beings. So now you have to provide rats with water that has been certified that water is safe for drinking. Water quality has to be tested. You have to report that the water quality that I am using has so much of sodium, has so much of calcium, has so much of chloride, so much of something and all fluorides or whatever it is there. This water I am giving to my animals. Now you know, in a country like India, where for human beings we are struggling to get whatever the water it is, borewell or whatever water. So you can imagine how can we certify this rat. So again this becomes a costly. Suppose now I say that I will buy only the mineral water from a particular brand of company and then provide. So human beings itself struggle to get a mineral water bottle which costs 20 rupees or 25 rupees. In a star hotel or a big hotel it costs 80 to 100, same water, same brand. He brought in a plate and then he said it costs 80 rupees, sir. So this is how. So when this is the situation for human being, how can we provide the rats with that quality of water? If at all we want to export, we have to provide that water only, mineral water only. So what is the cost of that experiment? Now you can imagine the cost of experiment. So again, an ordinary fellow again loses the chance of succeeding. Only a monopoly of a big brother attitude will come. So this is how for every study there is an advantage, there is a disadvantage. We are only discussing the scientific aspects of it. What is GLP? We are not into the political issues that this becomes so and so, this becomes, hence we should not do. This is not our opinion. As a scientist, what is GLP and what is advantage, what is disadvantage? This is what is our main motto. And then you have to write your protocol, what type of protocol that you are doing, and what type of drug you are testing at what time. Suppose you, today I give a drug at 10 o'clock, but tomorrow I'll give at 10:15. So you lost 15 minutes time. Have you recorded this one? That is what is GLP, good laboratory practice. 10 means 10 only. No, it's not 10:05 or 9:55. So that is what we have to adopt. That is part of good laboratory practices. Then about diet, food we are providing. What food we are providing? So yeah, we can see so many beggars struggling for even stale food in our country. But now you have to give food to the rats that is certified that this has so much quantity of the proteins, this much quantity of carbohydrate, this much quantity of minerals, this much quantity of vitamins added to that fortified, and so lipids are added to this one, and we are providing to the rats exactly at 10 a.m. So when people do not get this, again, not we are not comparing. I am telling what are the disadvantages. That's the only intention. It's not a political view. What is happening? It's a scientific view. So for a common laboratory, how much difficult and costly it becomes. That is the intent, not a political statement that we are against GLPs or we are for. It's not like that one. It is only whatever standards are there, how we a person who wants to set up something faces difficulty. That's a part of our discussion. So this is what in a nutshell and in the details of what this one, and you have to maintain a archive and a directory of all these things. Scientist who is in charge of this one has to maintain how many animals are dead, how many are surviving. If it is dead, what you have done with that dead body? Have you buried? Have you cremated? Have you incinerated? Have you exposed to IR radiations? What you have done with that dead body? That also has to be recorded. So everything that we do has to be recorded. That is, and you have to maintain these archives at least for 5 years. So suppose if after you feel that my experiment is over, everything is over, I got a PhD certificate, I throw all the documents. It's not permitted. You have to maintain what you have done at least for 5 years, so that whenever there is a check is there, you should provide that 4 years back I have done, these are the documents. That is what is called as archiving, and that is what is GLP. As in colleges and the universities, we maintain marks card answer sheets for 3 years. Some university maintain for 5 years, then they incinerate it. So like that, that is archiving. This is all part of good laboratory practices. What we wanted to dwell upon. So now forum is open for a couple of minutes. Any doubts are there from GLP? You may ask, or else we are proceeding to Schedule Y. Any questions, please, for a couple of minutes we can take, or else we'll proceed to schedule Y.
Mm, okay, sir. You can continue.
Yeah. Okay. Okay, sir.
Okay, sir.
Uh,
Okay.
right. Right. So that is part of GLP. Next, we are going to schedule Y. So schedule Y is also again part of same continuation of what we had already discussed. According to schedule Y, it involves permission to import and or manufacture new drugs for sale or to undertake clinical trials in the country. That is, nowadays we have so many clinical trial companies, and the market is more than 20,000 crores market, clinical trials. So many, including TCS, Tata Consultancy Services, they have also started clinical trials. Mylon is there. Plenty of such companies are there who are undertaking clinical trials. So far, what we had discussed was about preclinical trials. Now, clinical trial we are coming. So, in clinical trial, suppose I want to manufacture a particular drug that is certified somewhere, or some company gives particular drug to test it in India for BA/BE studies. That is bioavailability studies, bioequivalence studies in case of human being. That is where so many our pharmacy graduates are employed, and they take a handsome salary also. So in this schedule Y, when we import a drug or manufacture a drug, or ask, I have manufactured here, I want to do clinical trials in America, or American company has produced a drug, they want to do clinical trials in our country. Anything is possible, because we are all part of ICH. But usually in this other way, it comes from there and we test it here, because the studies are cheaper in India compared to other studies. There, if at all any reaction happens to a patient or anything happens, the company has to pay huge amount of penalty. And in India, of course, life is very cheaper. In many cases of clinical trials, some people were given a compensation of 5,000 rupees if a patient has died because of drug interaction. In some cases, 10,000. In some cases, 20,000. In some cases, maximum paid was 1 lakh rupees. So many drugs are tested on tribals, or on so many people. So many scandals have happened. This all we read through newspaper itself. If this happens in a developed country, if a patient dies there due to drug interaction, you cannot get away with 5,000 or 1 lakh rupees. It will run into crores. So that is why most of the drugs, they come from that place and they start testing in our poorer countries, or maybe Africa, or India, something like that. So that is part of Schedule Y. So Schedule Y says that when we get a particular drug for a particular from a particular research organization or a pharmaceutical firm for testing on human beings. So what we have discussed for animals, same thing is applicable to human beings. Who are the human beings? Who are involved? Have you taken their consent form? What is the body weight of them? And what facilities that you are giving? What insurance you are giving if they lose a hand or a limb or a eyes or something like that? This is all part of Schedule Y. Have you obtained sufficient animal data about pharmacokinetics, about absorption, about distribution, about acute studies, about subacute studies, about chronic? That is, let us say a company wants some trials to be done in India. The company is supposed to give all this data, as just now we have discussed in the GLP. The company has to adopt GLP and give a huge dossier which says that this was tested in rats on so and so date, and these are the results. This was tested in mice on so and these are the result. This was tested in non-rodent species in rabbits, these are the results. This was tested in so and so, and these are the results. This is absorption, this is distribution, this is metabolism, this is elimination, this is pharmacokinetic, these are the toxicants, this is what is toxic profile. So all these things, these are acute studies, these are long-term studies, this is a report generated out of long-term studies, these are histopathological results. So this much information he has to give to an Indian firm who is conducting clinical trials, and then only this Indian person, or whoever the person who is conducting the trials, clinical research organization, they have to pass on this information and get this information to a particular scientist or give to a scientist, and then only they are permitted, if they feel it is suitable, to try in human beings for clinical trials. Without this data, no country can use human beings for testing directly. That is what is the Schedule Y, or it may be import of certain specific drug samples, import of certain because drug may be a radioactive material, we do not know, or drug may be having some toxic substance which they want to test. So if they are not providing, if you give to our people 8 to 10 people, either they become blind, they may become deaf, they may lose speech caliber, they may develop cataract, they may develop kidney failure, liver failure. Anything can happen. So if the company doesn't provide this data, we will not test that drug. So company has to first give this entire data, and this data itself will take more than 6 to 8 years of time for developing. Then a big 6 to 8 years of information has to be compiled. You can imagine how much of big dossier it will be, and to be given to a clinical trial organization wherein he will import that drug and test in human beings. That is what is uh, a clinical profiling or a Schedule Y. Schedule Y says that you should have pharmacokinetic data, pharmacodynamic data, toxicokinetic data, and all the profiles of the animals, their histopathology, and then only you have to conduct. Then who is conducting the study, whether he is qualified or not, and who are the subjects wherein the studies are being done. Are they simply you are bringing some beggars and doing because life is very cheap, or are they normal human beings, or have they given consent? If they have given consent, have you explained in their mother tongue? Because simply if you feel that I am so much qualified, I can speak very good English, so I tell that fellow in English that this is so and so drug, this can affect your driving skills or something like that. But whether that person has understood, that means you should have a local translator who clearly says that this is so and so drug. If you take this one for clinical trial, you have to give your blood sample, urine sample, or whatever the sample a person is asked for, and then you should cooperate with the studies, or else you are free to quit the studies if you develop any side effects, or you report, or you are free to quit the studies also. So this is all part of consent form wherein it becomes a part of Schedule Y. So now Schedule Y is mainly concerned with this. What is the information? What is the route that the drug has to be given? Whether drug is intended orally, parenterally, or a patch, or a suspension, or whatever it is there. The company has to say that this drug has to be given by this route in this quantity to so and so adult. It may be meant for adult. It may be meant for pregnant. It may be meant for children. It may be meant for neonates. It may be meant for old age people. So to whomsoever it is meant, we should take consent for and inform them in their local language. Or if he is an illiterate, we should explain him. And when he is convinced and he is willing to give his consent, we cannot force him. We cannot bribe him by giving excess money and give your blood samples or so and so. At any moment he wants to quit the studies, he is free to quit. So this is how the Schedule Y goes, and these are the salient features of the Schedule Y. So we have covered today about good laboratory practice and good this one Schedule Y. The next aspect of our this one is alternatives to animal experiments. So if animal experiments are so costly, if animal experiments become so much difficult and cumbersome, so what are the alternatives that are available, that we will discuss. Again, the forum is open for a couple of minutes. If you have any doubts on good laboratory practice or Schedule Y, you may ask, or else we are proceeding for alternative to animal experiments. Any questions, please you may raise. No questions?
Sir,
Sir, please.
sir, whose permission is required to do the clinical trials in India?
In India, CDSCO, Central Drug Standard Control Organization.
CDSCO.
Yeah,
Okay.
yeah.
We will give the permission.
Yeah.
What is the present status, sir, in clinical trials in India?
Clinical trial, it is actually started as a 10,000 crore market. Later on, it became a 20,000 crore market. But the predictions were that it will cross a 60 to 80,000 crore market in India, with so much of job opportunities for pharmacists and other pharmacology-based persons. But very unfortunately, lot of uh, deaths and interactions occurred. So because of that, a lot of people started, awareness has increased now. They have started going to court and claiming the compensation. Hence, the market has not grown as it was predicted. So it is somewhere around 30,000, 40,000 crores only, or else it would have surpassed 1 lakh crore market.
Okay. So to enter into that clinical trials program process,
Right.
what additional knowledge our students should have?
They should have a pharmacology background. The first thing is that is most essential, because they can make out anatomy, physiology, and blood drawing samples. Of course, a doctor will draw, but they should be in a position to separate serum from the blood sample, plasma from the blood sample, analyze it in some suitable instruments. So that skills they are very much required.
Okay. Thank you, sir.
Right, sir. Shall we proceed to next topic, sir?
Yes, sir.
Yeah. So now today we are going to our another very interesting topic of alternatives to animal experiments. So this sounds, now the pharmacology people will lose all the jobs, and if alternatives come, what will happen? It's nothing like that. Whatever it comes, we cannot substitute for actual animal data or actual human data. Drug is very good drug in animals, but it fails in human beings. So this will happen. So because of that, whatever alternatives have come, they are mainly intended to reduce the cruelty to the animals, to reduce the torture to the animals, and to allow the natural life of the animals for them to lead as they are born. Whatever the nature or the God has allotted them time. Suppose if a rat is born to live in burrows, it should live in burrows its full length of time, and whatever the time span that has been allotted, maybe 2 years, and lead its full life. Same thing for a monkey or a rabbit, or there will be so many other activities. Suppose if a rabbit is there, there are so many wolves may chase, or jackals may chase, or some other animal chase, may eat away. This part of natural process. We are not creating any hindrance there, but we are not bringing them and caging them and avoiding their normal lifespan. Suppose if you cage a particular animal, same thing, same human end only. Suppose somebody puts us in a particular cell for a 1 year, 3 months, you can imagine how much stress we undergo. Same thing will happen to animals. If it may be a rat or a rabbit, whatever food you give, they have to eat. Whatever water they have to give, they have to drink to, so as to survive, or else they will die, because they cannot protest, because they cannot speak, doesn't give any rights to human beings to conduct experiments or interfere in the natural cycle. So there are so many activities. Hormonal imbalance can occur when we cage the particular animals, or they become irritant, or their natural strength also gets weakened. Suppose if a lion or a tiger is there in a jungle, it can take a leap of, let us say, 10 or 15 feet at a time to prey upon and pounce upon a particular its prey, whatever it is, food, deer or whatever it is there. But if you cage the animal, a tiger or a lion in a cage after 10 years, and then release them into the forest, most of the time that itself will become a prey to other animals, because it has lost or whatever the capacity to defend itself or pounce upon another animal to eat. Because in zoo, it was adjusted to the direct food only. Zookeeper provides a food, a ready-made flesh, so that eats and says things that yes, this is the life. But in actual situation, it has to live in a jungle. It has to take care of itself. It has to search for a water source. It has to pounce upon some animals. and when it is attacked by some other animals, it should defend itself, it should run away, it should find a safe place. All these activities that it learns there, by putting them in a cage, it has lost all these activities. So that is why so many organizations today, we see today no more circuses. This all we have seen in our childhood. In a circus, lot of tigers used to be there, and lion they used to bring, hippopotamus they used to bring, and then they used to bring these elephants and ask it to run a cycle, or so many play a football, so many activities, or horses running in a particular pattern. Now it's all not permitted, because it will lose its natural habitat, and we do not have any right to put those things, because they don't protest. If somebody wants to put us in some cell and this one, we have a police system, we have a law system, and then we ask for a justice for this one, or so many other acts are there. But for animals, this is not there. As human beings, we do not have capacity to put back the life in a dead animal. We don't have any right, or nobody has given any powers or rights to kill an animal. That is, when I don't have a capacity to put back the life in a dead rat, I do not have the right to take its life also. Isn't it? Suppose if I am given the right, dead rat, I will put back once again life. So I can kill and again I will put back. So this is not there. Suppose if it is done to human beings, what we will do? We go to court, we go to police, we so much law and order situation is there, that a fellow is put in jail for 10 years, 20 years, or he will be hanged if it is a severe crime. Kasam, what happened to Ajmal Kasam, we all know. He killed so many innocent people in Bombay VT, and then he was hanged, because we have a law system there. Suppose if we kill animal, who is there to fight on behalf of animals? Again, it's only human beings only fight, not animal organization, not animals. They don't come and fight that you have done injustice to us. So this is what we have to understand. That is, when I don't have a capacity to put back, I either do not have any capacity to kill the animal. When I don't want somebody to prick me with a pin on my skin because it causes pain to me, I don't have any right to prick a guinea pig or any animal with a pin and cause a pain, because it also experiences the pain. When I don't want somebody to dissect any of my this one organs, I do not have any right to dissect the organ of a rat, or stun it, or kill it, or pit it, or give anesthesia. Who has given the rights? Why we should consider ourselves as so much superior to other race? Because somebody else has created us, human beings and animals, and given this planet kingdom and earth and waters, everything, so that let everybody live the life that they are meant for. In natural process, whatever happens, it happens. An eagle is there, it pounces upon a snake and kills. A snake is there, it swallows a frog. A frog is there, it eats a butterfly or a small insect. A butterfly is there, it may pounce upon some other small ant, something like that. This is a natural ecosystem which sustains on its own. What we are doing by doing experiments, we are interfering in that cycle. Why we are interfering? We want, but still that interference is permitted to some extent, because the intention is noble, that I want to find a good medicine that is useful to humans, that is useful to animals, that is useful to plant kingdom. Hence, to some extent, this is legally permitted, but not our right as a scientist. Somebody has given permission to kill 10 rats. Doesn't mean that I should kill all the 10 rats because somebody has permitted. Is it justified? If 6 rats can give a very good data, why do you want 10 rats? Reduce the rat number from 10 to 6. If 5 rats can give a very good data that is sufficient, why do you want 6 rats? Let that 6th rat survive, lead its normal life. So this should be the aspect, this should be the way of thinking for a scientist and the organization, wherein how best we can save the lives of a particular animal. So all these aspects were thought of, and then the committee, pharmacologists, various other scientists, and social welfare organizations, and NGOs, and the government bodies, they all discussed on various platforms across the world, and then they decided that yes, This is very much true. When I don't have a right, I do not have a capacity to put back the life. I do not have a right to take the life also. Whatever pain I undergo, suppose if somebody puts a finger in my eyes, I get severe pain. Now what you are doing for mydriatic, meiotic, local anesthetic acting, you are putting a drug and poking that rabbit's eye with a tissue paper or some scale or something like that. You are measuring or putting lot of light into it, causing torture to them. It also undergoes same suffering. What happens to me, that also happens to that rat or a rabbit. Only thing is I am expressing it, that is not expressing it. So these aspects were thought of, and then the scientists decided that yes, these are very genuine. This one, hence they framed so many guidelines. That is why animal house has to be air conditioned, food has to be of standard quality, water has to be of good quality. They should be given a separate environment. They should be made as much comfortable as possible. They should be anesthetized if at all any sacrificial experiments are there. And suppose if you are doing drawing the blood of a rat, you bring six rats, rabbits, and take one rabbit in front of all the rabbits, then poke into its retroorbital this puncture and draw the blood. What you are doing scientifically. You are all permitted. You have a license. CPC has approved the experiment. But what is happening to the other five rats that are observing what you are doing? What is happening to all the five rabbits that you are they are observing what you are doing with that other sixth rabbit? Isn't it? This is like suppose if one person is doing surgery in the open, or as in so many countries, Taliban rule, etc. We see that they are tortured to death or something like that. If it is done in front of all the people, so how much stress or how much fear psychosis other people will develop by seeing such ghastly scenes? What will happen to the small children who see or witness such scenes? Even if we see a small accident on a road, many people start fainting and get giddiness. Natural accident only, but many people get giddiness because that is in public. If something happens or this torture happens, we cannot bear as human beings because we are sensitized to all these things. We are human beings, we have emotions, we have feelings, we have love and hatred, we have so many other things. So we should take care of about these things when we are dealing with the animals. That is how, even if you are permitted to sacrifice a rat, or if you are permitted to do some experiment on a rat, you should take out in another isolated room, close the door, do the experiment, and not in front of other five rats or five rabbits, because they undergo great torture. They cannot express it. Doesn't mean that they do not realize it. They very much realize it. Suppose if a person is taking a cow to a slaughterhouse, cow 100% realizes that it is going to die. Many a times it starts getting tears in its eyes. Only a sensitive person can make out this difference, that the cow is under great, it realizes that it is going to a slaughterhouse. It may not tell because it is helpless. Same thing can happen to the sheep when it is going to a slaughterhouse. It realizes that it's going to die, so it undergoes great stress. Isn't it? Suppose if Ajmal Kasab is there, court says that morning 6 o'clock he will be hanged. Today or 24 hours prior that sentence comes. So you can imagine that fellow's life in that 24 hours, how much horrible experience. Is as good as dead before 24 hours itself. He deserves death. That's 100% true, because but I'm telling a normal example, an ordinary example, wherein suppose if this happens, so that fellow is already dead. Suppose if some examination has been conducted and the teacher says that, anyway, that is a very bad example. I will give a good example. A teacher says that to a student before result, say, I was in university, I valued your paper, hopeless, you have not written anything, you will fail. Result has not yet come, it will come after 1 week. But from this 1 week itself, that fellow is so much nervous, he will never laugh in for 1 week itself. Isn't it? This is our day-to-day experience, because we have told him that you are not written well. He knows that he has not written well, but if you tell that you will be failed, so before result, university announces result, for 1 week, that fellow is nervous itself. So this is what will happen with animals also when we start doing experiment in front of other animals. So we have to take it in an isolated quarantine experimental room. There only perform the experiments and not in front of other animals. So this is how we have to make. As I told the example of a cow, told the example of a sheep, how they experience when they are in slaughterhouse, isn't it? In one of the American slaughterhouses, one of the cows very frantically ran away from a slaughterhouse. So it was so much it's under fear, stress. Somehow, very fortunately, it escaped from that slaughter cycle and ran away. And then all the people rescued it and they did not slaughter that animal. But that is another part of it. But I am telling how this can happen if one animal sees the other animal is being killed. On road accidents itself, we get so much disturbed if it's some accident or some bus falling into a trench or anything, whatever we see which is not acceptable, we feel a lot of anguish and pain. Same thing will happen to animals also. That is where various organizations came together and they decided that yes, we should find some alternatives to the pharmacological experiment. If 10 animals are required, let us do it on 5, 6. If 6 are required, let us do it on 5 without compromising on outcome of the study. This always we have to underline this, without compromising on the studies, how best we can minimize the experiment. Can we do more of alternative studies? Then we start entering this animal experiment rather than bringing on the first day itself, bring 10 rats, give the drug and test. Rather than that, can we test some other parameters of this drug for its purity instrumentally or for some other activity so that the drug is found to be yes, safe? I can give it to rats. So this is where we are helping the animal kingdom so that they lead a natural life, and instead of sacrificing 100 animals, we are winding up with 10 animals only without compromising on the result. So 90 animals are at least safe in the environment. So that is what is the alternatives to animal experiments. Why the need for alternatives came. So in that alternatives to animal experiment, I will give some of the important this one techniques. So what are those things? First of them is a computer based. Let us say computer based techniques are there. Some let us say memory enhancers are there. Memory enhancers on computer based techniques. So we can give to animals as usual pharmacological screening, or else suppose if a drug is a memory enhancer or a simple drug that is you want to test certain skills, we can do it on human beings itself, like matching of the colors, or on computer asking old people are there suffering from Alzheimer's, etc. You ask them to do some simple mathematics, or 4 plus 2 is equal to 6, or ask them to match some color balls. You mix all the color balls and ask them to separate the green color balls, red color balls, yellow color balls. So these simple things, wherever possible, as I said, without compromising on the data, can be done when the safety is proved. So that is how we are doing the alternative to animal experiment. That is, one is computer-based studies, but they are not substitute to the real animals. Computer may show excellent results, but reality it may not happen. So that is how one of them is computer-based. Next is called as patch clamp technique or PCT. This is one of the important techniques in alternatives to pharmacology. Very much validated technique, patch clamp technique. Before patch clamp, going into patch clamp technique, I will tell you a small story of how this patch clamp technique evolved. There were two scientists in German, Neher and Sackman, name of two scientists. They were doing experiments. They were molecular biology people doing a lot of experiments on the cells and molecular biology and all those things. They were given Nobel Prize for this work. So one day they did all their experiments and they were doing under microscope only some experiments, cellular level, molecular level experiments they were doing, and they did their job and went off to their homes. Next day morning, both scientists came, and when they came and they saw that galvanometer was showing deflection, that is, there is some current flow. Then they were surprised how galvanometer is showing a current deflection when all the experiments were over, and this, they saw that one electrode was under microscope only. This is all under microscope. One of the electrodes was touching one of the cells, and that is generating current, and that current was showing in galvanometer. So that was the first step how this patch clamp technique evolved. Then they became very much interested, and then they started doing experiments on that one only, and developed what is called as a patch clamp technique. So what is that patch clamp technique? Here, patch in the sense, we know what is a patch. Patch. In the Marathi, we call tigal. Tigal, pant, shirt, nowadays they wear, isn't it? That is a patch. In Kannada, tepe. Or a patch means this one. When our shirt, this one in earlier olden days they used to do. Shirt is torn means they used to stitch one small piece of cloth to that torn part. That is a patch. So now this patch you imagine for a single cell. Cell is a small structure, you all know. Cell we cannot see under normal microscope. We need a compound microscope. Then only we can see a cell, isn't it? There also, if you magnify maybe 1,000 times, we see only a cell, but we don't see Golgi body, mitochondria, cytoskeleton. We have to enlarge by 80,000 to 1 lakh times ultra structure of a cell. Then only I can see that what are the nucleus and other mitochondria, cytoskeleton, and other things I can see. Till then, I cannot see anything. So now these scientists called that single cell as a patch. So this concept you keep in the mind. Now, from a large ordinary definition of a patch, so there is nothing like a patch, or there is nothing, no patch, nothing. All that is under microscope only. Single cell they are focused, and that single cell is a patch. So what is that patch? To this single cell, they have enzymatically cleaned. This all experiment is under microscope on a glass slide, and what is the item? A single cell. So you can imagine how delicate this is. In a sterile, of course, sterile laboratory, no other interference, not even a dust particle is permitted there. So that a single cell, so they enzymatically cleaned it, and they started doing same experiments. They attached an electrode to that one, and then they attached a micropipette to that one, and then they saw that when the cell and that pipette are attached, this is a patch. Cell, this is a cell, this is a pipette, single cell we are talking. So that is a patch. Or else, very ordinary example I will give. In Jatra, Siddheshwar Jatra or whatever Jatra is there, you can see that village people will be selling balloons that is tied to a hollow tube. Hollow tube is there, balloon is tied, so you have to blow it, balloon blows it, and the moment you release it, all the air from the balloon comes out, making a sound. Play for a small children, enjoyment for children. Same thing you imagine with a single cell and a pipette. I think I'm pretty clear, because this requires a lot of imagination. That is why I'm giving all these examples. That is a bamboo tube, a balloon, you blow it, it blows up, and then when you release, stop blowing, air from this balloon comes out with a sound and gives a pleasure to a small children. So now this Snare and Sackman took a single cell. To this they attached a hollow pipette and called it as a patch. Now they are measuring electric current in this single cell. Neher and Sackman, two scientists, and later on they found out that yes, there is a current flow in a single cell. So from this one pharmacology background, you know that chloride channels, potassium channels, sodium channels are there on single cell. So because of this movement of sodium and chloride, there is exchange of electronic ions, and current was there, and that current was deflected in galvanometer. See, from single cell. And both of them, they reported this one, and later on, this is called as a Neher and Sackman unit. Both of them were given Nobel Prize for a wonderful work in molecular biology. Now our question is, how this is alternative to animal experiment, or what is the use of this one? So there, so what they developed is, so when electrical flow is there, if you, when a pipette and a micropipette of 0.5 micron diameter, very smaller than a capillary tube diameter, because we have to connect it to a single cell under microscope. So that when it is connected, whatever electric this one is there on that single cell, now what I do is I put some drug, I put acetylcholine, I put adrenaline, I put a calcium, or I put any drug that you imagine, I put on that single cell. Now what will happen to current flow? Whether it is increased, whether it has decreased. If it has increased or decreased, because of what this has increased, whether there is a sodium ion movement is increased, calcium ion movement is increased, chloride ion movement is increased. What is happening in that cell when I add a drug there and the current is deflection is showing? Earlier there is a current. Now I have added drug. So what is happening? Still there is a change in current flow. So why that change in current flow? That is because of this flow of the current or ions. This is one part, second stage of the explanation. Now third stage, how this is useful to us. This is useful in drug evaluation because in heart cell, RBC cell, liver single hepatocyte, brain cell, if you put this pipette and add a drug and find out a flow of current, this is useful to increase or decrease the heart rate. Person may be suffering from tachycardia, fibrillation, or heart attack, or any ischemic heart disease, IHDs. So there, how this flow can be increased, by what type of drugs. So now all these days what I was doing, I was bringing a frog, killing it, taking its heart, mounting it. Then I used to put so much of drug, syringe full of drug, and find out what is the effect. A rabbit heart, guinea pig heart, rat heart, Langentroff apparatus, and find out what is happening. Now what is happening? What Nair and Sackman did? They took a single cell, they connected it, heart cell they have taken, they connected to it, and what they have added to that one? They have added some small. How much drug is required for single cell? You imagine. Earlier, I used to put through syringe 1 ml, 2 ml of adrenaline or so. Now, how much adrenaline is required? In micromoles it is required. So, micromolecular drug concentration has to be added there and find out what is happening to the current. So, this gives a clue for so many pharmacology experiments. Now, I have saved a frog heart, I have saved a rat heart, I have saved a rabbit heart. I have done this because I have taken heart cell only. I have added a small drop of a drug and then I have found out measuring. And then I say that yes, this drug is likely to increase heart rate. This drug is likely to decrease heart rate. So I have saved so much of animal kingdom. And where I am doing this experiment, on my small table and a chair under microscope, by seeing under microscope. No animal house, no air conditioner, no food, no jhanjat, and still we are getting excellent data. This is patch clamp technique. So in patch clamp technique, suppose if I get a wonderful drug, I now have done a heart cell and I say that yes, wonderful electrical activity, I can use in a person whose heart cells are dead, some portion of ischemic heart disease. But when I give to animal, actual animal, this may not work out. When I give to human beings, this may not work out. That is called as false positive. False positive in the sense, in single cell, very good activity. When it is given to whole animal, it's not showing any activity. False positive. So by doing this patch clamp technique, everything has a set of advantage and disadvantage. So there is advantage that I am saving the animal life. Disadvantage that it may not work in the reality. Similarly, false negatives are there. False negative means I do the experiment, no change in electric flow, nothing has happened. So what I say that this is a waste drug, useless drug, it is not changing any cellular activity. So I throw it that drug or discard that drug. But in reality, it is a very good drug. It works very well. This I have missed upon because patch clamp PCT or patch clamp technique says that this is not a good drug. But in actuality, it's a reality, it's a very good drug. This is false negative. So we get false positives, false negatives. As I said, as a pharmacologist, always we have to be alert while doing experiments. There can be false positives, there can be false negatives. But only help that I get is that yes, probably this is a clue. So instead of killing 10 rats, 10 rabbits, or 10 frogs, I have done PCT experiment. I got a clue. Then instead of killing 100 frogs, I have done 10 frogs. This is what is patch clamp technique. There is no other substitute for actual experiments itself. But alternative, this is an alternative. PCT is an alternative, but not a 100% foolproof method. So again, we have to surrender to pharmacology experiments only and do this one. This is patch clamp technique. And again, Neher and Sackman continued their work, and then they found out modifications of this patch clamp technique. They call it as cell attached recording, whole cell configuration, outside out configuration, inside out configuration. 4 modifications they have done. So what are these modifications? So one is cell attached. As I said, balloon is attached to a pipe, a blow. That is a cell attached technique. Cell is there, it is attached. Whatever electricity is there, we are measuring. Now I say that there is a cell, I have attached it here, and I am measuring electrical current. This is a patch cell, and this is a pipette. Now, is it a foolproof connection? 100% there is no leakage. This cannot happen. Suppose if you hold water or a sand, it still keeps on flowing drop by drop. Like that, a pipette and a patch I have connected. It's not a 100% connection. It may be 99% connection. That means there is leakage current is there. 0.1% leakage is there. It's not perfect. It's not a seal. Simply I have connected it. I held like this. But as I hold water, drop by drop comes. Here also, I have connected it here. So still there is leakage is there. So what these people did is that then they developed what is called a cell attached technique. One is simply they have connected a cell, and in the next modification, they went for what is called as whole cell technique. So what they do in this is they connect and apply a suction vacuum. They connect, they apply a suction so that instead of here, it thoroughly attaches to this one. So because of that, what has happened? No leakage currents are there. So that is what is cell attached technique. Then further they started thinking, can we do still something more in this one? Then they developed outside out technique, inside out technique. Outside out technique means this is cell, this is outside of the cell. So I apply a suction, I suck it this one, and it forms a perfect seal. And this outside is outside only. So I connect to internal cytoplasm, Golgi bodies, and then measure correct. That is outside out. Then next fourth technique is inside out technique. Inside out in the sense, I again apply a pipette, I start sucking inside, I suck in such a way that this forms a balloon. Suppose in childhood again we used to play, isn't it? Suppose somebody parents give a big balloon, we play with a balloon. Then what happens? That balloon after playing it bursts. But after bursting balloon, we don't throw that balloon. We take that one, hold in our mouth, suck it inside. What forms? It forms a small other balloon inside. Again, we tie a thread and we start playing with it. So that is what is inside out technique. That means they start sucking it inside so that it is inside portion of this one is left out, and then what outside is required, that is connected to a pipette. That is inside out technique. So these 4 techniques, this Neher and Sackman developed modification of same patch clamp technique, and then they started measuring physiological activities in RBC, in a heart cell, liver cell, brain cell, renal cells, and started developing so many drugs. So molecular biology experiments and alternatives to the experiment. That is what is PCT or patch clamp technique. Next, another 2 patch clamp technique. Next is HTS technique. HTS technique or high throughput screening technique. These are so very interesting technique that is developed. So as I said, for inventing one drug, it requires at least 1,000 crore rupees, 15 years of lifespan of a scientist, and so many animals. Then only acute toxicity, chronic toxicity, subacute, and Irwin's battery test, and so many things that we do. 10 to 15 years is required for developing all this. Then another group of scientists, what they did is they developed what is called as robotic assays. That is high throughput screening or HTS. Later on, it became UHTS, ultra high throughput screening. I will give you a preamble. It becomes very easy to understand. This is very easy technique. This is robotic, 100% sterile environment. Nothing is a sealed glass cubicle, and a robotic assay. So what they do is now what instead of doing experiments on actual animals, what I do is I bring alpha cells, I bring beta cells, I bring some histamine cells or some uterine cells, and then I go on adding drug to this one receptors. and see that whether it is binding to the receptor or not. If it is binding to the receptor, yes, this acts on histamine receptor, this acts on acetylcholine receptors, this acts on histidine 5-HT receptor, serotonin receptor, something like that. I keep on making, so that instead of repeating the experiment in so many animals, what I am doing is I am doing on a small receptor itself. If positive results are there, I extend it to the animals, or else I stop the experiment. What is the advantage? I am not killing so many animals. So it is an alternative to experiment. So what it is does in high throughput screening, they are called as wells. A plate will be there, a small plate upon which various wells are there. Earlier there used to be 356 well. Today 1000 wells are there. Well, in the sense we imagine a small socket, small socket. In that small socket, one receptor, you put one molecule of drug, find out whether it is binding or not. Earlier, what you used to do, you take a guinea pig ileum, mount it in an organ bath, add histamine, then add an antihistaminic drug, and see a contraction on the chymograph of a smoked drum, whether it is contracting or not. Then say that yes, this is antihistaminic drug, anticholinergic drug. Now, what I am doing? I am doing it all on a small cell, which is called as a well. In that well, I place a cell, I add a drug, I make out whether it is binding to it or not. So they are all, because once receptor, few receptors if I am putting, there is likely to be contamination for this one. So what they do is they do it in perfectly sealed environment, and a robot does this assay. Commands are given from outside by a scientist. Outside, by sitting here through a remote, he gives a command, robot goes there, adds a drug, and then says this is the report. So now in a throughput screening, 50,000 to 1 lakh compounds can be screened per week. In 1 week, 50,000 to 1 lakh. Earlier, as I said, one molecule to test, it requires 15 years of time. Now, how many? 50,000 to 1 lakh drugs in 1 week. In ultra high throughput, this is in 1 day. 50,000 to 1 lakh chemical molecules in 1 week is a throughput screening. 50,000 to 1 lakh molecules in 1 day is high throughput screening, ultra high throughput screening. So now what is the problem in this? Oh, wonderful, it's a very wonderful theory, and drug testing, instantly we can do. Do you know the contribution of Indians to the allopathic drugs till today from independence? 4 or 5 drugs. Memory plus, Hamicin from Hindustan antibiotics, like that. Very little we are not speaking of Ayurveda contribution, we are speaking of allopathic contribution. 5 to 6 original drugs from India. Rest all we have process patenting, product patenting, importing, something at all we have done. So for so many years, how many pharmacy colleges are there throughout India? How many medical colleges are there? You all know. Maybe more than 3,000 pharmacy colleges, maybe 2,000 medical colleges throughout India. But how many research molecules are coming from all this entire fraternity of drug pharmaceutical firms? Negligible. Now what I have? I have a robot with me. What robot is doing? 50,000 to 1 lakh molecules in 1 day it is doing. Now I have brought that robot costing maybe 10 crores or 100 crores. I don't have a drug for testing itself. Earlier, one molecule they used to extract. MPharm, how they produce one molecule, they do 6 months studies, isn't it? Suppose I have 6 MPharm students or 3 PhD students, and in pharmacology work, all of them for 1 year or 3 years they work. They bring 6 extracts and test. How much time they have spent? 3 years or 4 years for PhD, 1 year or 2 year for MPharm. So how many tested you have done? You have tested altogether 6. In these 5 years, you have tested 6. Now I have a robot which is doing 50,000 to 1 lakh molecules in 1 day. So you imagine how much of the sample you have to feed it continuously, or else the machine will stop in 1 day itself. It's enough. There is no use of the machine because no drug suppliers there, no chemical suppliers. So this is what will happen. Advantage, disadvantage. So many scientists are required who can produce 50,000 drugs per day and give to that robot and test it. Here we are speaking of a MPharm or PhD program for 5 years, and which will isolate one plant extract and test for 5 years. After 5 years, you are giving one drug to that robot for testing. Now I am speaking of 1 lakh such potential drug molecules to be tested in one day. So many scientists are required, so much of resources are required so that we can test. So that is what is ultra high throughput screening. This is also a very good alternative to animal experiments. Again, here also we have false positives, false negatives. False positive in the sense ultra throughput screening says that very good antihistaminic drug, but when you give to actual person suffering from allergy, no use of that drug. That is false positive. False negative in the sense ultra throughput screening, nothing has come. It has not shown any activity. But in actual practice, it's a very good drug which we have missed because HTS says that the drug is inactive. So, like that, both are quite possible through high throughput screening, but it's also an indispensable tool for a scientist for testing all this. Suppose if they have some central laboratory throughout the world, so one laboratory is enough to take care of entire countries of the world to supply their drug and get it tested. So that is what. So today we have 1,000 well, 1,200, 1,300 well robotic assays. That is 1,300 drugs and receptors you can test in one go and say that yes, this is H1 blocker, H2 blocker, H3 blocker, H4 blocker, H5 blocker, H1 agonist, H2 agonist, 5HT1 blocker, agonist, 5HT2, anything that you name, you can. Okay. Renal cells, kidney cells, hepatic cells, heart cells, anything you take, add a drug through robot and say that what is the activity. So it may come in reality, it may not come in reality. That is patch clamp technique. So this is also another indispensable tool. Various drugs are tested through this successfully through this HTS technique also. So computer assay is one alternative. Next alternative is PCT or patch clamp technique. Third alternative is HTS, high throughput screening, or UHTS, ultra high throughput screening. Both are same. In ultra high throughput, it will do in one day. Throughput screening, 1 week. Fourth technique, fourth alternative to animal experiment is cell line techniques. Cell line techniques in the sense today we have what are called as renal cell lines. They do commercially also in Bangalore, etc. They do a lot of cell line studies and give the report. Many people are doing PhDs on cell lines itself. One of my students is doing a PhD on essentials oils on cell lines itself. He is doing on cardiac cell line. He is doing on cancer cell line. He is doing on so and so cell lines, and he gives the sample to the company. They give the report on cell line. This is the activity. This is the inhibition. This is the binding. In reality, it may be good. It may not be good also. Same again, advantage, disadvantages are there for them. What is this cell line? How actually it started? Cell line in the sense a single cell line of a single microbial, incubation, microbial sample you incubate in a petri dish, tomorrow you will get a colony of microbes. Like that in cell lines also, you incubate a cell, develop a lot of cells, a single layer of the cells. That is cell line, and a specific type of cell lines. I have liver cancer cell line, brain cancer cell line, heart cancer cell line, or from pancreatic cell lines, cervical cancer cell lines, lymphomas. So many types of cell lines are right now available. They are available. Each one assay will cost around 3,000 to 5,000 rupees if you want a study on one single cell line. Suppose if I am interested in cervical cancer, I have to pay 3,000 rupees and give my sample. Within one day, he will give a report that your drug is active, inactive, like that. That is cell line study. Ordinary college laboratory, it may be difficult, but when the laboratory is established only with that intent, cell line studies are quite possible. So many in Bangalore, so many such laboratories are there who give the services, commercial laboratories who charge the money, like NMR studies, they charge money and give the report. X-ray studies, because colleges cannot afford an X-ray machine or an NMR machine which costs 50 lakh rupees. So we hire them from somewhere else and pay the money for that one. So like that here also cell lines, we have to hire, or if we have a sophisticated laboratories, you can develop your own cell lines. So how this cell line story started basically. Again, this is also one of the interesting stories of it. One lady was there in America who was suffering from cancer cells, cervical cancer. She died also, of course, while during treatment and after treatment, she died. But what the scientist, that doctor who was treating did is, he took those cancer cells and incubated them. Incubated and grown into a separate cell lines. That cancer cell itself grew from that woman, and from that was the first cell line. It is called as HeLa cell lines, based on her name, HeLa cell lines. HeLa. She was suffering from cervical cancer. HeLa cell lines developed. Of course, it was unethical. He had not taken permission of that lady that I will continue studies on your. She died, but our cells are still alive in the laboratory. Even today, they are alive. Cell lines. So like that, but now they have to take permission and so many other aspects. That was since first pioneering experiment that started. Now scientists have developed that yes, we can incubate these cells, grow them in the laboratories, and then find out if a drug is anti-cancer drug, add on that cancer cell and find out if it is curing that cancer, that is anti-cancer drug. Earlier, what you used to do, you induce a cancer in a rat or a mice or a tumor in that one, give anti-cancer drug and find out whether it is curing cancer or not. Histopathologic study or body weight or whatever the studies that were there. But here, what is happening? I have taken in a cell line in a petri dish, added a drug, no activity. So I say that it is a drug is an anti-cancer drug, not an anti-cancer drug, like that. So that is what is cell line. So after that, taking this clue, many scientists developed so many other cell lines. Today, we have cell lines for hepatic cancer. Cell lines are there. Brain cancer cell lines are there. Lung cancer cell lines are there. Cervical cancer cell lines are there. They are commercially available if you want to do, but they are very costly. Each cell line, if you want to buy and do in your laboratory, it may cost more than 50,000 or 1 lakh rupees, like that. But since they do experiments regularly, they give you each sample, one dose. They may charge 3 to 5,000 rupees and give the data to you. But they will not give cell line; they will give only the data. So that is how cell lines developed. Today we have a variety of cell lines. There are two types of cell lines. One is called as finite cell lines. Second is infinite cell lines. Finite cell lines means when I incubate today first generation, I take one cell, incubate second generation. I take one cell, incubate third generation. I take another, incubate fourth generation, fifth generation. So after some generations, whatever condition food you give, the cell will not grow. That is finite cell line. Today we have BT brinjal, isn't it? BT brinjal and so many such sunflowers, biotechnologically modified. This one size is very big, but seed termination. Uh, this one plants there. Seed termination in the sense, suppose if you take a grow a BT brinjal, each brinjal may be 2 kgs. Very nice. It gives a lot of profit to the farmer, but he cannot regrow the seeds once again. If he grows, the seed will die there only. That is seed termination. They terminate. Otherwise, whatever seed you eat mango, put that seed into the soil, it will grow into a new plant and you will reap lot of mangoes again. Guava seed you sow, you will get plenty of guava. Orange seed, lemon seed, you eat lemon, orange, put the seeds in the soil, you again grow into a tree, you will get lot of lemon. But in this chain termination, you will not have that facility. But advantage is it will grow into a 2 kg tomato, one tomato, 2 kgs. Lot of profit to the farmer. But disadvantage is that every time you depend on that supplier to please give me the seeds, I want to grow once again. That fellow today he has given for 10,000 rupees per kg, tomorrow he will say 50,000 per kg. Till that time, this fellow has lost all the technology of growing the brinjal itself. After 5 years, 10 years, he doesn't know how to grow brinjal. So he thinks that only I have to buy seeds and then only brinjal will grow or mango will grow. Because chain termination, he has terminated that seed itself. Otherwise, you take eat the fruit also, put it into the soil, again a new tree will come. But in chain termination, nothing of that sort. So this is where it makes a lot of difference. This biotechnologically modified, like that finite cell lines. Once it grows, it will stop after some time. Infinite cell lines, you culture as many times you want, it still continues. That is how HeLa cell lines are till today they are available. HeLa cell, infinite culture. Either you grow as a monolayer or you grow in a broth culture, suspension. They are all single cells. So you take the cells, add a drug, find out what is happening. Same thing like your microbial incubation or streak culture that we do, broth culture, streak culture, same thing here also. So that is how this cell line technique is another important technique. And you have to bring a cell, triturate it, and then separate into individual. It's a mass of cell. It's separate all the individual cells, culture them individually. It grows into a monolayer. Again, broth medium and all. They say this much of protein, this much of agar has to be added, sterilized, and then grown into an incubator for so many hours. Then you put this cell, then it will grow. This is technical procedure. But what is basically cell line? This is basically cell line. You can add again advantage, disadvantage. Advantage is you are saving the animals. Disadvantage is false positives, false negatives. In cell line, it is a very good drug. Actually, it is not at all a drug. In cell line, it doesn't show any result, but in actually it is a very good drug, which we have missed upon. So both are quite possible in a cell line techniques. So these are the four important techniques which are used as alternative to experiments. One is computer techniques, patch clamp technique, single patch, and the studies of electrical deflection. Then high throughput screening, wherein we put drugs on receptors, and cell line techniques is the fourth one. These are all what are called as alternatives to pharmacological experiment to save the life, to save the cruelty, to save the animal kingdom, and get best possible data. Based on this data, you extend to animals, depending on your resource, depending on your facilities that are available, depending on your interest that you are involved in the research. So many avenues are open for all these techniques. So as promised, today I have covered GLP techniques. I have covered Schedule Y techniques. What is Schedule Y? Then I have covered alternatives to animal experiment. Almost we have completed your 75% of your syllabus, and now last CPC guidelines, animal house technique CPC guidelines are there. That is also pure like a story only. It's how animal house has to be, how a cage has to be, what is a dirty corridor, what is a clean corridor, what to do with the dead animals, how to bring the animals, where to keep the animals, who is a technician, what he has to. All these things are a part of CPC guideline. Tomorrow we'll deal only with CPC guideline, maybe for 1 hour, and that completes the assignment that the Solapur University and my good friend Dr. Kalshetty and Dr. R.Y. Patil have entrusted upon me. So I take this opportunity to thank for completing this 75%. And any doubts are there for a couple of minutes, we are open, or else we are logging off.
Participant, any questions?
Good evening, sir.
Good evening.
Audible?
Yeah, you are.
I am Nitin Deshmukh.
Yeah,
Uh,
please tell.
I have been listening to you since last three sessions.
Okay.
Then I really feel that I never feel disconnected. You know, so
Yeah.
that kind of zeal of knowledge that you have, and the passion of teaching and all that, I really, uh, I must say, so the remarkable knowledge that you have, and I must say that all the participants will get the benefits from what you have taught us since last three sessions. So remarkably, you taught preclinical screening, fingerprinting, toxicity studies, IRB stage, GLP, and Schedule Y. So I just wanted to know in GLP, so which are the studies that we need to be conducted in GLP environment so as to file the IND?
Uh, for that one, your laboratory should be certified through that one, either ISO certification program or some certifying agency should certify it that you are competent enough to carry out these studies, and then you can go for investigational new drug studies, INDs, or whatever studies that you are planning for.
Okay, so just all the preclinical studies like efficacy studies or just toxicity studies or safety pharmacology studies that need to be done in GLP environment, or efficacy study also we need to complete in GLP environment.
Everything. GLP, simple thing is GLP is like a visa to enter any country. It's like that only. GLP studies, if you supply the data, any country will accept that one. That's the only simple logic behind that one.
Okay, so thank you.
Thank you.
Any other questions? Hello.
Yes, yes, please.
So already you have explained in detail. I think there are no questions.
Yes, sir. Thank you, sir.
So today I explained for animal study, that is GLP, for
Right, right,
clinical Schedule Y,
right,
and alternative techniques
right,
to avoid the animals in study. Again, you are
right.
saying that animals are important. Without
Yes,
animal, that is not concluded.
yes, yes, yes.
On behalf of all of us and our college, I am very much thankful to you, sir. So today we will stop.
Yes,
Again,
sir.
we will meet tomorrow.
Yes,
Thank you,
yes,
sir.
sir. Thank you, sir. Thank you, and a good night. Thank you. Thank you.
Participant, you can leave the meeting.